Good evening. Thank you so much, Dr. Jayant. And thanks to ISCCM and the team, including Mr. Neil. I think this is a great occasion. And thank you for having this session included in the STEP training program that we have for the nurses as well as the doctors. So we are going to discuss about soft skills. I know some of you must be aware, but most of us, still having been known about this topic also, tend to be unaware of it. And we have to now understand that it's become an important part of our practice and our care that we are imparting anywhere in the hospital, and more so in areas which are very critical in nature, more so like the ICU or the emergency setup. So with this background, we'll take you through for the next 30 minutes about what is soft skills and how is it to be done, what is it, and what is there in us to be learning, and what is it to be practicing in the daily events that we have on a day-to-day basis. So we are going to discuss about why soft skills. We are to discuss about what is soft skills for people who don't know. When do you apply the soft skills and how do you apply the soft skills? So I think that is something which all of us need to be knowing. And you can see on the left-hand side the importance. It's not just for the doctors. When I mean doctors, I talk about doctors, nurses, technician, attendants, all the people who are attached to the ICU and people who are attached to healthcare services in the hospital. So a lot of focus has come about, as you can see here, that now people have taken it as an integrated course. That's going to be a new curriculum for people who are attached to healthcare. So that's the importance of soft skills. Now, the question is, why do we require soft skills? So if we have to simplify and put it forward to all of us as to what are the 3 points which are genuinely important for having soft skill is one, because it is a quality index now. The second point is that it is a component of the professional competence, how we are actually performing at our professional level. So this is a check or a measure of that. And finally, as we have seen in the recent times, is basically to avoid volatile situations, which we are going to discuss one by one. As far as the quality index is concerned, so if we have to talk about the quality index, we have now understood that all the institutions across the world have realized that there is a need for inculcating soft skills along with the hard skills. And the goals today are customer expectations. So obviously, when you have customer expectations, then these expectations are to be met. And that is all because you have to have a good reputation. Your brand really matters. Now here I would like to just focus upon, we are going to discuss about soft skills, but when we talk about hard skills, I know all of you must be knowing that these are the academic qualifications. These are the years of experience that you have. These are the technical skills that you carry, which you have which have made you quite good and successful at your work. But over and above, you have to also have the soft skills, which we are discussing currently. Now, regarding care of patients, you might be having very good bedside clinical skills. You have given them a very nice treatment. They have got treated from their disease. They have come out a long way, and then they have got discharged from the hospital. And along with that, you have something called good communication and behavior that you have. So we have to understand that despite of doing the best of your clinical skills application and treatment of these patients, if you are uncaring and unresponsive, I hope all of you understand that you do not care for your patients, you treat them as subjects. You do not respond to them at all in terms of emotions, in terms of their feelings, in terms of their requirement, and you're just taking care of the medical aspect, then please take in mind that this is what your patient will always remember. They will forget each and everything of the good medications, the good treatment, the good techniques, the painless techniques that you have applied on the patient. If your behavior was uncaring, if you are not responsive, if your communication was not good with them, your interaction was not good with them, then remember all your 99% of goodness will just go down the drain. And that 1% of your not having interacted well with them or not having behaved well with them will be always staying with them. And that will make 100% of a memory of them regarding their stay in your hospital or in your workplace. So that's the importance that we need to understand. And you have to always pay attention to this, whatever said and done. We might be very good with our work, but we have to have soft skills, which have to be of the higher quality too. Now, the second component is it's a component of professional competence, I said. So as I told you earlier, the hard skills are the medical skills, all your academic qualifications, all your techniques and your skills. These are important, no doubt, because these are the very basic requirements which help us get a job. So once you've got a job, but after that, if you have to be well regarded, If you have to have success in your job, you have a good name, and you have to be really good and popular with your people, with your patients, and everybody around you. I think that is something which you will look forward to after 1 or 2 years of experience in your workplace. Once you have mastered your clinical skills, once you have mastered your medical work. But now, what people look forward to is having good soft skills also, so that you become quite successful. And then finally, the third aspect, which is important for soft skill, is to avoid volatile situations. So as we all know, that what do the patients or the relatives require once they come to the hospital or any healthcare setup? You have to give them immediate attention. Your quality of care should be good, and you should be having proper communication. Now, if this proper communication is not taken care of, you have given immediate attention to patients, you have given them a good quality of care, but if your communication is improper or not good, then everything is lost. And that is something which leads to a volatile situation, which is very common in the current days. And we have all of us, in fact, have gone through it and seen it and have been very much keeping ourselves updated with the social media. So improper communication is a problem, as you can see here. Any poor communication or any improper or inadequate communication leads to disappointment. It can lead to frustration and loss of faith. It's like a vicious cycle. And that follows by anger, outbursts, and violence against healthcare professionals. If it doesn't have to stop here, it can go to litigations. And obviously, after so much of stress and struggle and all the bad times, you're also having a loss of reputation. So you have to understand this cycle, rightly put up by the author, where they say that a poor communication can lead to all these problems, and all of us should be aware of that. And we should be taking measures to avoid such kind of a situation. Now, violence against healthcare is common, and it can start from telephonic threats. It can go from intimidation. It can go on to verbal abuses. It can be going still further and worse in terms of physical assault, which could be non-injurious and injurious also, as we have seen in current times. And finally, it can lead to vandalism, arson, and murder. Not very uncommon, and has been quite very much in news and still happens. So that is something of a concern. All of us are aware of these news pieces, so it keeps coming. Maybe it has come down to a certain extent, but it was very much in the news in the last 2 to 3 years or 5 years, I would say, where a lot of attention was paid to this particular aspect. There were a lot of publication and voices raised in terms of the violence against healthcare workers and medical profession. And it is very much evident by the different surveys or studies that was done in the past. In fact, this was done 5-6 years ago, the study, which showed that almost 75% of healthcare personnel experience violence at workplace. Now, this is a problem which is not just common to India. It is a problem all over. What has been seen is present in the US, Australia, China, any country that you name, wherever healthcare systems are there, they are accompanied with such kind of violence against healthcare. But what we have seen in our country, that there was a steep rise in the last 2 to 3 years, which was disturbing, and was more aggressive and had a violent form. And also to understand that almost 70 to 80% of these problems occur in emergencies and ICUs, because these are the areas which deal with maximum number of critically ill patients, and you have a lot of catastrophes or bad outcomes happening in these situations where it becomes difficult for the relatives to accept it. So this is the bad situation, and also not just the reputation and the violence, it is also in terms of financial loss or compensation, like a 500-bedded hospital lost almost $4 million per year because of communication efficiency. So this is a high magnitude of loss that happens because of the ineffective or the improper communication. So action has been taken. Now, the law and the body have taken strict action against people who have been doing it, and there are laws which are coming in place to prevent such kind of a situation. But it is also in our hands. It should not be just left on to others. We are also responsible for getting things right and preventing such untoward incidences or such untoward actions which are happening. So it's time that we need to be proactive. And here is the role of soft skills, which we are going to discuss. You also have to understand that when people come to the hospital, they go through different phases. The first one is when they start behaving in a calm phase, when there is normal behavior. But once they find that they are unhappy with the treatment, they're unhappy with the communication, their stay of the patients and the medical care, Then it goes on to a pre-assault phase where the behavior turns from a normal one to a threatening one. And finally, if you are not able to act here and you are not able to take control of things, then it can go out of control in form of a assault phase where everything is out of your control and it's high time that you really get off from this situation. So what we have to understand that you have to take all these actions while the patients are in between the normal behavior phase and the threatening behavior phase. So when they are in the calm phase, try to prevent any situation or complication which is happening or which would happen resulting in a pre-assault phase or an assault phase later. So here we need to be proactive and we need to act in this particular phase itself. There are various causes for the volatile situation or whatever unhealthy or untoward actions that we had talked about. So out of these, like the common ones are because of socioeconomic factors over which we have no control. We have institutional factors, again, over which we do not have much of control. But we also need to understand there are patients and relatives factors, which has to be understood whenever we are dealing with these patients. And finally, the healthcare professional factors. So here, regarding the patient's relative factors, we need to understand that this will be coming about, like in situations where relatives are not able to meet patients or see them, or they see them in distress and they are quite disturbed. All these patients more during COVID times and the relatives were going through very difficult time. They had uncontrolled emotions as a result of which there was a lot of anger, despair, frustration, fear, and misinformation. This got aggravated during the COVID times, but was also there in the past where people were having a lot of these situations happening. And then the most important factor is an ineffective communication. If you're not communicating, be it with your patients, with the relatives, or anybody who's interacting with you, then it can really lead to a problem. And finally, what happens is all these, with this background, even trivial issues or small matters could really flare up into big acts of nuisance, violence, and litigations, which you'll be having a lot of difficulty in controlling it if you have not taken care of it right at the bottom. Then finally, let us come to our level of commitment and our level of contribution to this factor, the healthcare professional factors. See, we all know that all of us work very hard. We are the pillars of the ICU or a hospital. We have a high workload. We have very high stress levels. But that is also a part of our job. We need to understand if we are not going to do that, who will do? If we have taken up the responsibility of becoming doctors, nurses, technicians, and working in highly stressed areas like the ICU, it is important for us to do full justice to this job, and we have to take care of all the problems that is coming to us. A patient or a relative who is coming to us, he doesn't want to know that we have not slept over the night, we have been working continuously for the last 7 to 8 hours. They want treatment, they want communication, and we have to ensure that all this quality of care, all the best of care and communication, everything is given to them as per their expectation. All of us have received excellent medical training, no doubt about it, in terms of whichever field we work in, but we have not received much of training related to empathy, which I'm going to touch upon. So that is something which we have to accept, that there was no empathetic training given much in the past, or not much of importance was placed to it. We have inadequate communication skills. Yes, you will see that you might be very good talking to one person or within your group, but if you're led to talk to patients, relatives who are unknown, you're led to talk to a big group of people who are coming to to you with all the problems, and they are in a irate mode, they are very much unstable, then a lot of people fumble there, and if they do not have that much of confidence of experience, they're unable to handle that situation. So this is something which we need to be gearing up. And that is what I said, your skills of handling emergencies or any kind of a volatile situation or a mob or a group of people or people having confident questions or trying to charge over you, you have to have those skills in handling these situations or emergencies. More so right now, the mask phase, all of us putting masks, interacting with people, this has actually led to a lost connect. All that the patients and the relatives can see is a muffled face, voice within a mask that we always carry over us, which does not have any expression. And we remember that earlier it was the expression, it was your eye contact, your sound, the type of interaction, the verbal interaction that you were having. All that was having too much of importance in interaction. But right now, with the mask on, I think everything has changed. And these are the new challenges and modes of communication that we have to accept. But that's how it's going to go. We have always tried to treat the disease. Like a patient comes with pneumonia, we focus on pneumonia, we focus on oxygen therapy, we focus on antibiotics, fluids, ventilator management, and everything. But we forget that we have to manage and treat the patient altogether, not just the disease. So that is something which we need to understand as healthcare professionals. So the need of our in improving all these factors is the soft skills, which is very important and has to become an important routine in a day-to-day practice. Now let us come and understand too, and what is basically soft skills. So to put it very precisely, soft skills can be defined as the ability to connect and communicate with others, respect differences, work with teams, and build relationships. I have actually highlighted the key points which one can always remember. It is basically the ability to connect and communicate with others, respect differences of people all around you, work as a team, and build relationship again towards working as a team. So I think these are the key aspects which comes. So it talks not about your interaction with patients and relatives. It also talks about your interaction with your colleagues, with people working around you. So the key pillars of soft skills are good and effective communication, good teamwork. Adaptability basically means how you're going to adjust, how you're getting uh, mixed with the people around you, how's your level of tolerance, and how you're actually turning out into a good team or a working atmosphere your people around you. And finally, something beyond sympathy, which is called empathy. So sympathy, if I have to put around with you, is sympathy is that I feel sorry for the other person. Oh, I feel so sorry for this other gentleman who's having a lot of pain and a lot of suffering. So that's sympathy. The whole story closes here. Whereas empathy is a step higher than sympathy. Now, empathy talks about trying to be in that other person's situation, trying to put yourself in his shoes, and as to understand as to how he's feeling, what pain and what feeling is he going through, what are his expectations, what would he want at that point of time. It is similar to suppose if I had been in his position and this is what I want, or this is what I would have expected. To understand is basically empathy. So this is something which all of us should do. Try to put yourself in the other person who is right across you, be it your colleague, be it your patient's relatives. Understand the amount of pain or suffering or whatever they are going through. Just imagine if you were put in his position, what was your expectation? How would you have liked people to be treating you? What would have you wanted things to happen? Which way and how it would have, how would you have wanted it to happen? I think this is all what empathy is all about. So it does not stop here about feeling bad. It's about going into their place, putting yourself in their place and trying to understand their feelings and act accordingly. So I think it's a big word and we have to have a lot of importance paid to this particular terminology. So when to use soft skills? So to make it very simple, basically soft skills are used at two situations. So it's all about effective communication. The first one is an interpersonal communication, which comes between healthcare personnel, that is with you, your colleagues, your peers, your juniors, your all the personnel who are working in your hospital, in your setup, all around you. So that's the communication happening between you and others. It's basically an interpersonal interaction. And the second one is a healthcare personnel and a patient-related interaction. So this is very common while you're working in your hospital or any place. You're always interacting with the patient or the relatives or their well-wishers or their friends around. So this is the second kind of interaction that we are having in a day-to-day practice. So soft skills have to be applied in both the situations where you're having an interaction with your colleagues or whether you're having an interaction with your patient relatives. So why is it important to have good healthcare personnel interaction or good interpersonal interaction should happen between healthcare people while you're working? Why? Because you should be having a good atmosphere where you're working. Nobody wants where people are making faces, where people are talking negative, where people having kind of very unhealthy interaction, and then you have to work under so much of stress. I think nobody would like to. You want to spend your time enjoying 7, 8 hours of your work in a very good atmosphere, which is friendly, which is cordial, which is warm, where you can put in your best rather than stressing on untoward incidents or trying to stress on unnecessary action or nuisance which have been created. So good working atmosphere is the very basis of requirement for all of us. The second one is a good and a strong information network. When you have good communication between people working around you and who are interacting with you, this leads to a good information network. There is continuity of care. Every information is passed on the people. It's not that you take all the information, close the matter within 7 to 8 hours of your work, and after that you go home, you switch off your phone, you block your phone, and then you're at peace. I don't bother what happens in the hospital or anything that I've missed out. So I think that is very important, where the communication and the continuity of care should be flowing. You have to have a strong information network. A proper handing over process has to be there. A proper communication network has to be. And finally, it avoids the errors and complications, the litigations, the problems, the volatile situations, then the inquiries, then all your finger pointing starts only if you create problems in terms of error, complications, or unwanted problems. So if you have been able to have a good interaction, communication, and a handover process, then it will prevent all the errors and complications. The second aspect is your effective communication with the relatives. So it is an interaction between the healthcare personnel and patients' relatives. So this is very important. I think you are doing it on a daily basis, but here also you need to understand how best you can be doing it. So you have to always remember that such type of a communication should always be done in person on a one-to-one basis, or whenever you should be meeting live with them. During COVID, we started doing it on the phone. We have done it quite often, and later it was either a phone call or a video conferencing. So that was the limitation. But whenever you have to, you should be always doing live or in person with a direct communication or an eye-to-eye basis as much as warranted. Obviously, this was difficult. This was the COVID times, but you had to do it on phone. But in situations where there were critical patients, it was always to be done in person also. So here, why do you require this communication between healthcare personnel and patients' relatives? Basically, it leads to a good sync. You have a good connect with the patients, the relatives, and everybody who's working. In fact, you also make the patient's relatives a part of your team by keeping a good connect, good communication, and good sync with them. The whole of their stay goes as a smooth sailing. You're informing them, you're keeping them connected with the treatment, with your communication, with the care, with the different possibilities, with everything that they expect or everything that they want. You're taking care of each and every part. So I think that's a very smooth sailing that happens, and people really take it in a very good note. It avoids all the different problems, errors, and complications. And you will find that if you're quite good with all your care, that is your hard skills and your smooth and your soft skills, there'll be very less of problems coming about. So you're actually doing the prevention, where you're avoiding all kind of a problem that could have happened by applying all the good part of your soft skills and the hard skills. You get a lot of recognition because of the good work that you're doing. You might be doing great work with your clinical aspect, as I told you earlier, your medical skill, your patient outcome, your complications with a very low percentage, and over and above, the behavior, the good communication, and your soft skills will give you a lot of recognition, and you'll have the goodwill and support of the community. That's very important. We need to be putting ourselves high up in the community as well as the society, and that's how you're going to achieve this. Now, let us understand the tools of soft skills as to how you should be, or what are these soft skills that you should be applying in a hospital setup. So I think we'll quickly go through it, about 3 or 4 tools that we'll be discussing, which are quite relevant to a day-to-day practice. But this is something which you can take note of and start practicing right from today or tomorrow. So some of the first tool is, whenever you are meeting people or whenever you are interacting with people, so there is something called telephone etiquette or an interaction. So here what you have to do is very simple. I think there are different names put up for whatever different steps you have to follow. But what we can make it simple is a 5-step procedure, which starts with treating people. Whenever you are interacting on the phone, whenever you are communicating with people, whenever you're meeting people, in fact, in your workplace or anywhere around, you're leaving the hospital, you're working in your unit, you're working anywhere, just across the hospital, moving from one ward to another, going from one place to other also. And whenever you're communicating on the phone, remember these 5 steps. The first one is greet people. There's no problem in just giving a sweet smile. I know with the mask on, you might not be able to, but you can wish them. You can just bow your head or shake your head and wish them. You can say good morning. You can say namaste. You can say anything and everything to them with a very sweet note. That will really take up quite a good amount of your respect in the eyes of people. The minute you say that these are the people who are wishing us, who are greeting us. Next is whenever you're interacting, learn to introduce yourself. So many times we see that I suppose I have to draw blood from a patient. So you're very nice with them. Hello, good morning. Can I see your left hand? And then you start drawing blood. So that's a wrong way. You might be very soft with them, but that's not how it should be going the right way. So once you have greeted people, good morning, please introduce yourself. I am so and so. I'm working here as a staff nurse. Can I take a few minutes of yours? So that is, then you have to explain as to what. Either you have to talk to them on the phone, tell them, I would like to talk to you about this patient. If you're talking to people in a different ward, if you're talking to patients' relatives, can I talk to you about your patient who is under treatment for the next 3 minutes or 5 minutes? Or if you're talking to the patient, I want to do certain examination on you. I want to collect blood, take blood and samples from you. So can I do that? So I think it's good, like spelling out a few things. We take it for an assumption that they know that why you have come here for. But no, you can always be very explicit. You have to be very open. Just try to speak out whatever you're going to do on that patient. And I think that will be very nice. Then do the talking, do the explanation, do whatever details you have to come about. And finally, end your note with a thank you. So I think if you're on the phone, you apply the same 5-point step that we have talked about. Greet them, introduce yourself, then tell them a preview of whatever you want to talk and the time period. Like, can I talk to you about the shifting of a patient from my ward to ward? Can I take a minute of yours? Do the talking, and then a thank you. So I think if we are able to do this whenever we're interacting with people around us, be it anyone, the patient's relatives, the patient, our colleagues, or anyone that we're interacting with, if we can just do these small 5 steps, I think this will be a lot of value addition to your work and to your name and fame. So I think this is something which we can do. This is very basic. Always work towards team building and collaboration. See, trust and influencing. Try to generate trust. Try to get into the habit with your good deed, with your good behavior of influencing people around you. I think you'll feel really happy if people have regard and respect for you because of your good behavior, good communication. And they try to work as a team with you because you have been helping, you have been really trying to be very fair and transparent with all of them, and you're having a very positive attitude. And also emotional intelligence, which talks about trying to understand the empathy factor and trying to understand as to what is the expectation of others, what are they feeling, and you go a step further in trying to address their problems, trying to communicate with them in a better way. So I think these are the basic steps of having a good team, and always work as a collaboration with all of them to have a good teamwork. See, conflicts are very common. We always see conflicts happening at different levels. It would be between doctors, it could be between doctors and nurses, it could be between nurses. Like as you can see here, a doctor taking downs with all the people around. One of the consultants says, let's intubate this patient. The other one, right on his face, goes on, no, there's no need to intubate it right now. So this is a conflict which is happening right in front of eyes of all the people who are taking rounds along with you. 2 sisters or nurses, they're working together, and then brothers, they are there and they are working. And then suddenly during the work, when people are around, see, you think that you're talking to the other person, but remember there are so many eyes watching you. And then they go into a confrontation. Like one person says, your work is always complete during a handover process. The other one says, I'm always overloaded. And it starts off from a harsh tone or hard talk to really getting unhealthy and something not very good. So these are conflicts which are very common, but we need to understand that these conflicts should not happen in front of others, and there are ways of managing it. So the more you do it, the worse that you get to it. So there could be multiple causes of the conflict. It could be because of any issue. It could be because of ego. That is very common. It could be because of value. So I think these are some things which are really very common and seen on a day-to-day basis, but we need to understand it, and we need to see to it that we are actually avoiding it by the different steps that I had shown earlier. In fact, either you can be compromising, you can be collaborating. So there are different ways. So you cannot avoid it. You cannot compete or win over it. So the best way is having a compromising attitude. Try to understand and try to take a middle path. Honestly, do not let things go out of hand. You should be more accommodating. Let's work always as a team. If you have issues, please call the person separately in a different room, not in front of everybody, and try to settle it rather than making a fun of ourselves in front of everybody in there. All of us do feel and have a lot of volatile situations coming across. Despite the hard work that we are doing, we will find that people are really rough with us. They are always getting into altercation and they are having very bad interaction. So like I give an example, like I move into a unit and I find that the patient's relatives are having a heated altercation with a nurse who is at the central station. Now he's shouting that you have not given food to my patient and my patient has been fasting, my patient is sinking, this is the level of care that you're giving in your hospital and this is what you're doing, I'm not happy, I want to take my patient away. So you enter, there are 2-3 different ways that you'll be thinking about. Oh, the gentleman is having an altercation with a nursing staff over there, why should I bother? Well, let that person handle, I am not a part of it. So that's one way. The second way is you'll quietly move out of that place, having not bothered or taking any responsibility or ownership. Or the third one is also that you try to go and try to shout at the other person. That's also not good. So I think the best way to follow is this 4-step approach, which is displayed right in here. The first thing is take ownership. If somebody, any of your colleague is in distress or there's an altercation going on, try to go and help the other person. Take ownership. Tell them, okay, I'm so and so. Good evening. I would like to just listen to you. Can I help you with this? And try to shift the focus of that whole altercation. Then you start by believing them and tell them that please tell me what is your problem so that you're there to listen to them. The minute you tell them that you're there to believe and listen to their problems, you will see the anger that was at 100% comes down by almost 72, comes down to almost 60 to 70%. Because now they know that there is somebody to listen to them and there is somebody to believe them. So you have to believe them because 95% of people do have a reason actually. 5% might be just doing it for creating problems, but 95% always have a reason and we should be regarding them and we should be listening and believing them. So once you have let them speak out or blurt out all their problems, all that you have to do, apologize. Just say a sweet word called sorry on behalf of everybody. You won't lose much. You have to just say a sorry on behalf of everybody for the inconvenience caused. We never met it. I think that will again bring down their anger from 60 to 70% to almost 30 to 40%. And then they'll start feeling bad. Oh, did I overdo things? Did I create more problems than that should have been done? And then you come out with your solution or try to resolve the problem. Like for that particular example, you can tell the people that, see, your patient has been kept fasting because there was certain procedure to be done. We wanted to monitor the blood sugar that was low, that was high initially, and the patient was put on insulin. So all that was being done as part of the treatment protocol that was being done. You have just come in, so we couldn't communicate to you. So we would have anyway spoken to you, but your patient has been told about all the treatment plan or whatever you want to do. So you have to resolve it rather than just letting it go the worst way from a very normal phase to a volatile phase. So this is what you should be applying whenever you are handling with any volatile situation. So this was the second tool. Always remember the 5 golden rules of communication. Whenever you're interacting with people, be a very good listener. Listen. Never blurt out with answers. Always think. After you have listened properly, become a good listener. Try to think. And then only you speak once you have decided as to what should be the rational or the relevant answer be, not coming out abruptly or without any rationale. You should come out in a very matured fashion, speak out whatever is the fact or the truth or whatever is to be spoken about. Ask more and more questions to have more clarity and never react. Never react, never hyperreact. So I think if you follow a good listening, thinking before speaking, asking questions and not reacting, so I think this will be quite good for all of us. Your body language is also important when you're dealing with people. So if you can see here, the spoken words only account for 7% of the impact. In fact, the tone of a voice is responsible for 38% of your impact, and the non-verbal communication, Now, the non-verbal communication is basically, I'll go back here. The non-verbal communication is how you're interacting with people, how you are having the eye expression, how you're having your gestures, what's your appearance, how confident you are. So these are all part of your non-verbal communication. See, nowadays, we know that all that might not be very much evident because our patients no longer see our faces. They're not just seeing a mask. And people say that we have to learn to smile with the eyes now. In fact, yes, the expression comes about basically how your eyes are, the eye diameter is changing because when you're smiling, how the muscles around the eyes are going about. So it's quite stressful, but you have to learn this is the new way of communication, which is very different for what we have done in the last 10 years or so. But that's how it is right now, and all of us have to follow it. So apart from all these tools, always remember that patients and relatives and your colleagues handle them with care. So here comes the role of empathy. See, we deal with serious patients day in and day out. They are critically ill patients. They're on the verge of death. They're not coming out, most of them, or some of them. So for us, it's a daily routine. A patient who has come with 4-organ failure, with a mortality or outcome of almost 95% and above death in these patients. So for us, it's common. We know that these patients might not make it. It's going to be leading to a bad outcome. But for them, remember, for the patients, relatives, and people around them, it is for the first time. It is quite shocking for them. And we have to understand that it is very difficult a situation for them to accept, and their emotions will be uncontrolled. So here in this situation, you have to have a humanitarian touch. That's what empathy is about. Try to understand their problems and their feelings, and you have to act accordingly. Feel their pain, feel their agony, treat them well. This is the moral responsibility that all of us have towards our patients and the relatives who are suffering. Some more points to focus on: your appearance and presentation. Always conduct yourself well. Be very confident. Whenever you're talking with people, have a good knowledge of the patient's condition, because they might be noting each and every point of yours. For you, it might be a generic statement, but for them, it stands for their particular patient who is being treated in there. And be careful of your words, be very transparent, don't give false hopes. And you might also have people who would be recording everything that you are speaking out, which can be used later for good or bad, whatever. So you have to be very, very much universal with your approach and very much transparent with your approach. Give all your attention when you're dealing with people. There should be no casual approach. Try, if you are talking to them, talk to them straight. If you're working on your laptop, if you're doing something else, please ask them politely to wait for a minute. Can I take 1 minute? And then I'll be coming back to you. And after that, once you're interacting with them, do it on a one-to-one basis. It's not that you're working on your computer and you're asking them, please tell what's your problem. So that's not the good way to communicate. Communication with relatives, we should be always doing it regularly in a stipulated time. Give them correct and relevant information. Don't give them vague information or incorrect statements. Inform immediately about any change in condition or rate. That means to say that anything, the patient is deteriorating, the patient is requiring organ support, there is a treatment plan change. So I think that all needs to be communicated to them on a very live basis, means anytime, immediately it should be done. Be very polite, but at the same time be firm. It's not that politeness means they tell you to do anything and you do everything. No, you are polite to them, but you are doing what is right, what is logical, and what is rational, and you're quite firm about it, but with politeness. And always end any communication on a good note and address all points. It should not be on a very bad note so that it can lead to problems later on. And apart from that, always remember to have proper communication and documentation. Like this is a communication format which we use. Anybody can use it once the communication is done on admission, subsequently on a daily basis. So we should keep track and we should keep a record of whatever communication is being done, because this will also be a record of the interaction being done on a regular basis. No one can negate it. Remember the warning signals. There could be dissatisfaction, grievances, accusations. There could be rude talk, rough and hostile behavior. Relatives start asking new questions. They have a lot of new visitors coming in, and they come together in odd hours, and there is a crowd built up, and they're trying to show their resentment. So all these are warning signs. We need to be more careful and take additional steps to prevent any untoward situation later on. And finally, going on to breaking bad news. Remember, breaking bad news, it's an art. Breaking bad news could be like prognosticating a patient who is quite sick, prognosticating the relatives about bad outcome, or something which has been diagnosed as a situation where the outcome of these patients are quite bad and they might not come despite the high support that you might be giving. So this is the spikes protocol. So basically all of it you are aware of, very popular. The spikes protocol talks about how one should be declaring bad news to the patient's relatives or anyone around there. So the spike, the S of the spikes talks about a setting or a location. You should have a proper location for doing this communication. Never try to declare bad news while walking casually on the corridor, on the phone, or just walking anywhere during your ward rounds. It can't be done casually. You have to have a proper location done for it. Understand the situation, what perception people are carrying, what is to be said, told, and how have they accepted it. Then, once you have done this, please invite them to talk. People should have the willingness to listen. If you have 5, 6 people who are not wanting to listen, try to figure out the person who seems to be more rational, more logical, who is ready to listen to you, and try to invite him to talk, or the people whom you have been talking to on a regular basis. A little familiarity is there, so you can call them and you can speak to them. And once you're speaking about the patient to the relatives, ensure that you have a proper knowledge, everything in detail about that patient. You can't come out casually or with wrong details, because that's going to really aggravate things, and that will really lead to a bad outcome, because the relatives will say that you are hardly aware about my patient's condition. How is it that you're managing my patient, and what you're doing with this talking that we are spending time with you out here? So you have to explain facts properly, explore their emotions, that means to say, bring in empathy, try to be helpful, try to be supportive, try to soothe out things for them. They are also going through a turmoil. They're going through a lot of pain and agony, but what we have said, because of all the bad news and the situation that is happening. So that's where empathy should come about. And finally, summarize or strategize that I know your patient was quite dear and he was an important member of your family, but know this, that once he came to us in the hospital, we have done whatever best, every bit, and the best of care was done. But unfortunately, despite all that, because of the comorbid condition or the problems that this patient was having, so the outcome is quite bad in this situation. So that's how you should be soft, outspoken, and you should be handling these situations. So finally, if we have to really get ourselves standing out from the crowd, you have to become a good one, have an edge over others. Remember, your soft skills always shine along with the hard skills that you're having. See, this has been said for clinicians. A good physician treats the disease, while a great physician treats the patient who has the disease. Well said by William Osler, but that is very much required for us. We need to be great nurses. And this program is for the nurses, and all of us should be taking a strong message that all the soft skills that we have learned, we should be actually applying it on a daily basis, and that will help us quite a lot. And you will see for yourself that there will be a very drastic transition in the impression or the perception that people carry about you. So I think I'll end my talk, and Dr. Jayant, we'll be happy to take the questions and interaction. Thank you so much.
Thank you, Dr. Asif. It's an excellent presentation and deliberation from your side. Such a wonderful presentation, and so beautifully you have been explained. The first thing, all the medical students, be it or healthcare personnel, be a doctor or be the sister or whoever working in the hospital setup, hard skill is definitely there, but the more you are having acquainted with the soft skill, it always distinguishes you from the others. But that is the most thing which we have been noticed, and we are learning in our day-to-day in hospital rounds, as well as during the COVID round in last 2 years, whenever we are coming out from the ICU and these things and interaction with the patient relatives and these things, it has been definitely showed us how the soft skill distinguishes from the others in this COVID period, and how the doctors as well as the sisters they was equally important dealing the patients as well as the relatives. The 5 components which you have been emphasized, the communication skill, the empathy, the great teamwork, these are really the pillar of the soft skills. So with this, I would like to open the session with all the audiences who are over here a lot of sisters, brothers, as well as our professional workers are with us today's evening. If anybody is having any questions, Dr. Asif is there, myself is there to give you the answer so that we can have a good communication and good interaction with all of you. Anybody, please?
Thank you, Dr. Jayant. Sunil, I think, okay, the audience, if they want to put up questions in the chat box, that's fine. If they want to put up question live, they can raise their hand and Mr. Neil will coordinate and we'll be happy to take your questions in a live interaction. So.
Till now, there is nothing in the chat box. Nobody is having answers, question. And Dr. Asif, one thing I would like to ask you, during this COVID period and these things, when in Tata main hospital, whatever, in every ICU, we are practicing the same thing which you has been described and these things. So is there any special things, those who are in a distant part and these things, the phone communications you was doing every time?
Yes, yeah, Dr. Jayant, actually, yeah, what we realized was with the high load and with the out of certain uncertainty these people were having, getting them into the isolation wards, where earlier they were supposed to meet, they were allowed to meet the patients a little twice in a day. Now it had stopped completely. Like once these patients went on to an isolation ward and isolation unit, it was a complete disconnect. So that was adding too much of a dissatisfaction and problems coming out. So we tried initially, obviously the relatives are not allowed to go into the COVID wards. So what we did was initially we had the telephonic system into play. We were giving the information. But again, as you know, for all these serious patients, you might not have, there are so many people wanting to have an answer for their patients. And you just can't come out with a simple statement or one-liner statement that the patient is critical or stable. That's not something where we actually in the ICUs work like. So we did that on the telephone, we did that with the messaging system, but later we thought that this will not work. So the best way out was to have a physical interaction. So that took a lot of time. In fact, that was additional time spent, but yes, we did go out and started talking to the people. So we saw a drastic change in their perception. They were more understanding and they accepted things better. So we also had a messaging system, like in every shift, the doctors and the nurses, they were putting up the patient status, and this was sent as a message to the patient's relatives. So that was the additional thing that we did. But we were very particular that on a daily basis, we would be communicating with them twice. So that is something which we have to. Communication has to be there. And that's the, actually, this is the very important aspect which can take off all the problems. Yeah. If you have done whichever difficult situation you're going on to, but your effective communication, your good communication skills, obviously the good work, the clinical treatment and all apart is also a part of it. But if you have done with good communication and effective communication, I think that will take off all the problems. Yeah. So all of us need to understand, And also, Dr. Jayant, it's about your branding, it's about your reputation also. Everywhere people are giving treatment. You are doing 95%, you're doing a great job, spending extra time, you're doing everything for your patients, for relatives, for colleagues around. But if you can just add a little bit of cream to your cake, by saying few good words, by smiling, by greeting them, by saying thank you, or having a very soft interaction with them, you will see that your 95% becomes 100%, and you're right at the top. People have a great impression about it. So I think that's something which we should do.
Yeah, you are rightly pointed out. And the best example in our India, I think so, Dr. Devi Shetty has been example. He's a best person who has been how the soft skill has been overcome everything which we have been noticed from his deliberation and these things in different aspects and these things. So he's a living examples of how to share these soft skills among the patients as well as the relatives and these things.